Good morning, everybody. Thank you so much for joining in. My name is Caroline Wadege. I'm your moderator for the day, and it's such an honor to have you with us. As we start off, we'd like to begin with a word of prayer, and I'd like to request my colleague Lillian to pray for us, and then we take it up from there. So Lillian, karibu sana, and just lead us in a word of prayer.
Good morning, everyone. I am Lilian. Karibuni sana kwa our webinar, and let us pray. Our dear God, Father, we want to thank you for this morning. Thank you for the gift of life. We want to thank you for this webinar, God. May you be with us as we start, and when we finish, we shall thank you and glorify your name. For in the name of Jesus Christ, we pray and believe. Amen.
Amen. Thank you so much, Lillian. Thank you very much for the prayer. As I've mentioned, my name is Caroline and Wadege, and it is an honor to have all of us here today. As we all know, our webinar today is about gastrointestinal conditions in children with autism. And with us, we are having a very able facilitator, Dr. Washeke Kombe. She will be joining us in just a few minutes, and she's looking forward to interacting with all of us. And before we bring her on board, I would like to tell you a little bit about Gifted Gems, and also after that, probably get a few of your expectations as we move along. So Gifted Gems, we are an organization that deals with civic education on autism. We also provide psychosocial support to caregivers of children with autism. And we also equip caregivers with skills, basic skills on how to handle our children with autism. We major on 3 pillars, that is early identification, early diagnosis, and early intervention. So all our programs and activities are geared towards achieving the objectives as outlined. So today is one of those days. We are here to equip ourselves with information and knowledge on gastrointestinal conditions in children with autism. And as many of us may attest, in the journey of autism, we have quite a number of gastrointestinal conditions or issues that affect our children. And I know for some of us, the question is, what do I do? How do I even know it's a gastrointestinal condition? And so you're in the right place. Karibuni sana. And we hope to interact with you. Feel free to ask questions, to engage with us now and even after. We are open to hearing from you. In case you'd like to know more about us, you can visit our website. We have our website, www.giftedgems.org. You could also visit our YouTube page. It has many videos, past webinars we've been doing on autism, from the therapies, the diagnosis. You will find several webinars that will equip you with information and the know-how on what to do as a caregiver. Or if you know somebody who'd like to access the same, feel free to share them. Our YouTube page is Gifted Gems as well. We're also on other social media sites. You'll find us on Facebook, Gifted Gems, LinkedIn, Gifted Gems. You'll find us on X, Gifted Gems, and you'll also find us on TikTok. So we are in various social media platforms, and we give monthly topical items about autism in children. So karibuni sana, that's about us. Before I go on, I'd like to hear from you as you have made time to just join us. What are your expectations for this webinar? And so that we can share the same with Daktari as she joins us. Please feel free. We take about 5 of them and then we move along. You can unmute or send in the chat any expectation that you have for this webinar. Lucy, thank you for your expectation to gain more knowledge on the topic. Joan, thank you to understand how it is connected to autism. Without much further ado, I'd like to bring on board Dr. Washeke. Dr. Washeke, karibu sana. It is an honor to have you with us today, and we are eager and looking forward to learning more from you. Before you came, we had some expectations that our caregivers had raised. And maybe just to bring you up to speed, is that for most of our caregivers, there was an expectation on understanding how gastrointestinal conditions are connected to autism, to know whether constipation is part of GI issues in autism, and whether there is need to see a specialist. Also understanding more about the topic. And we also had an expectation on from a caregiver who was asking about her 12-year-old who's autistic and always complaining of nausea and often includes vomit. Is it part of GI or is it something else happening? And they've been treated for constipation before and recently, and all stool tests have been okay. So those are some of the expectations that have been brought forward just before you arrived. And I'd like to now bring you on board. And as we have seen in the posters, Dr. Washeke is an associate professor and a pediatric gastroenterologist at the Aga Khan University. And I would like to welcome her to introduce herself further and to take it away from there. Karibu, Daktari.
Okay, thank you very much. Caroline, can you hear me?
Yes, I can hear you.
Okay, so thank you once again for inviting me to this forum. And it's an honor as well as a pleasure to be here. As you said, my name is Washeke Nganga Kombe, and I work as a pediatric gastroenterologist at Aga Khan Hospital. So I deal with children and specifically stomach and liver issues associated with the different conditions in pediatrics. And I think, some of the questions that you're discussing are actually issues that we're going to be covering in the interview. So I don't know if you'd want me to address those right now, or you'd want us to just go into the discussion, and then maybe after the discussion, if the questions are not answered, then they can come up again. Yeah. Yes,
I think let's go into the discussion, because I know some of those questions will be answered as we go along. So Daktari, please tell us a little bit about autism to any of us who may be joining us and does not know anything about autism.
Okay, I think you're even better placed than me to discuss this. But well, autism in brief is it's a neurodevelopmental disorder that is characterized by impairment of social communication and social interaction, and it is accompanied by restrictive and repetitive behaviors and activities. So of note, it mainly touches on development of the child. In most cases, it's a child. And the striking feature is usually the impairment in social communication and social interaction. And so it's kind of like a hidden disability, I would say, because you don't see it immediately when you look at somebody. But when you start to interact with the person socially, then that's when you start to see that there are some challenges that the person has. I think in brief, that's how I describe autism. Yeah.
Yes, thank you. Thank you for that, Daktari. Maybe you can tell us about gastrointestinal conditions. What are they, and what are some of the examples that we have?
Okay, so being what we've called a neurodevelopmental disorder, you've heard people say that the gut is the third brain. Yeah, so meaning that the gut is very active in terms of neurons and development and even immunity. And so because these are areas that are touched on by autism, it's no surprise that there are a number of gastrointestinal conditions that are found in children with autism. And these are not conditions that are necessarily unique to children with autism, but they are conditions that are common. It's just that we find them to seem to have higher frequency in children who have autism. So conditions that are found to be higher percentages would be like constipation, what we'd call a highly restrictive diet, micronutrient deficiencies, obesity, reflux, chronic diarrhea, inflammatory bowel disease, celiac disease, as well as bloating. So it's a large repertoire of some of the GI conditions. So it's just to say that these conditions seem to be more prevalent in patients with autism. Yeah.
Are there some symptoms, like from all the ones you've listed, what are some of the most common and what are the symptoms that a caregiver can look out for?
Okay, maybe if I could just add, in terms of the prevalence, how common they are, studies that were done, just looking at general GI disorders, they did not pick one in particular. It looked like those who have autism seem to have a 4 times higher chance of having the GI disorders, but that was like in a whole ballpark figure. So back to your question, what are the early symptoms and signs that you would see? I think the symptoms of these conditions are they are similar to children who are neurotypical in that age group. The challenge is that in children who are, say, 3 years and above, you would expect the child will be able to localize pain and maybe tell you that this is, what I'm feeling. And a child with autism may not be able to do that. So you may just notice behavior changes, irritability, and maybe if you seem to touch them somewhere, they're irritable. So they may not be able to verbalize. But something else you could do is, just massaging the child everywhere, just to try and understand where could this pain be. So that at least you're able to localize to where the pain could be, because it could be anything. It could be a fall. It may not necessarily be related to the GI, but so look out for behavior changes or irritability that is not what was happening before. And when you find that, think about, because there be something hidden in the gut happening that this child is not able to verbalize. Yeah.
Okay. There are times when, when you have a very small baby, like from 0 months to about 1 year, can you pick it out that there's a GI issue? Especially 0 to 3 months, they cry a lot. Can a caregiver pick up that there is a GI issue?
Yes, you can pick up there's a GI issue. And, that is now across the board for all children. It's not, at that time, you've not even diagnosed autism. Yeah. So for that child who's having a GI issue, what are the red flags to look out for? So commonly you hear conditions like reflux, colic, and those are common in many children. And we don't necessarily treat reflux or treat colic, but when it is extreme. So what we look out for are more like the red flags. So if I take something like reflux, which is where baby brings up milk after feeding, that is normal. But we are worried if the weight gain is stagnant, so the baby is not gaining enough weight, or if the baby is now not able to feed, like the disturbance is so much, the child is not able to feed, then we are worried. Or if when they bring out, it seems to have milk, then you're worried. or some behavior symptoms we see where the babies are really arcing the back like very acutely, and it's like there's pain. So there's some red flags that you think about in reflux. Same thing with colic. If a child seems to be having colic, typically that child will feel some relief after they've passed stool or gas. There'll be relief. So if this child is not getting any relief despite passing stool or gas, abdomen remains distended, feeding is now affected, then we worry about it. Another one I'd give maybe as a final one would be constipation or not passing stool every day. So many times we get the concern that, my child is exclusively breastfeeding but not passing stool every day. And if a child is just exclusively breastfeeding, feeding is going on well, child is happy but not passing stool, again, we're not worried. But if the child now starts to not feed, abdomen is distended, then we get concerned. Yeah.
Okay, thank you. Thank you for that. I believe now caregivers are starting to pick out what to look out for. Yeah. Let's talk about causes and risk factors. What are the potential underlying causes of GI issues in children with autism? And are they related to autism itself, or are there other contributing factors?
Okay, so some would probably be related to autism itself. Like one of the ones I would want to discuss is the restricted diet. So you'll find that children with autism sometimes have a very strict restriction on what they want to eat and what they don't want to eat. And so that now starts to affect the nutritional, what the child is getting nutritionally. And so you can get now micronutrient deficiencies. And in some cases, you can even get macronutrient deficiencies. And so when that happens, it affects the weight gain, it affects the child's immunity, and puts the child at a higher risk of infections. If you look at the diet of restricted diet, many times the children want to take complex carbohydrates, starches, and these foods have very little fiber. And so that puts them at a higher risk of constipation. Yeah. Then we would discuss later, but there's what we call the gut microbiota and the gut microbiome. So if I was to introduce the topic, the microbiome represents the microorganisms. They're not all bacteria, but many are bacteria. The microorganisms that live in your gut. And there's a lot of microorganisms that live in your gut. The microorganisms that are there have more cells than the total number of your cells of the body put together. So it's a huge number. Yeah. Now, the microbiota affects our health. And so we have now started to identify that the way your gut looks in terms of the diversity of the different bacteria that are there, it's associated with different conditions. We've associated it with allergic conditions, and it has also been associated with severity of symptoms in autism. Yeah. So there are certain bacteria which have now been shown that if you have this bacteria in high amounts, you're likely to have more symptoms. Yeah. So that manipulation of the gut microbiota can affect the symptoms. Yeah. I don't know if you don't have to discuss that wholly right now, or we do it later, but I don't know what you feel.
Let's continue with it so that we don't get lost. Yes.
Okay. So there's a bacteria called bifidobacteria, which has been found to be associated with severity of symptoms. And the challenge we have is that, we talk about how do you manipulate now the microbiome, yeah? And what has been suggested is probiotics. So again, what are probiotics? So probiotics are organisms, they are microorganisms that are protective. So we call them the good bugs, good bacteria. And what has been done is that you take some medicine which contains the probiotics, and then those good bacteria, they change now the equation in your gut so that you have more of good bacteria, and so that can then change the symptoms. The challenge we have with probiotics is that their effect is not sustained. it's kind of, you have to keep taking those probiotics. The minute you stop taking, your microbiota starts to revert back to the setting that was there before. And so we are not sure that this is necessarily the answer to changing the microbiota. If you will excuse me, there's another method that has been used, which is also interesting but controversial. It may not be very palatable to everybody, but it is what we call fecal transplantation. Yeah. So fecal transplantation means that you actually take in somebody's feces, they are cleaned out, put into form of a capsule, and the patient is given as medicine. And that then has showed better sustainability. The effect of that lasts longer than just a probiotic. It's still very in the research phase. We've not started giving that locally, but I do know that there are some conditions where it has now started being given around the world. Yeah. And so in summary, in terms of the microbiota and the probiotics, I would say.
Sorry, Dr.
Sorry, I was muted. Okay, I was saying, so we know for sure that the microbiome plays a role in conditions such as autism. What we are not convinced is whether probiotics is the way to alter that microbiome favorably. Yeah.
Okay, well, we are still at that. I know many caregivers have been using probiotics. And what is the alternative? There is the kombucha. Do they work? I think it's so correct if I'm not wrong.
Okay, so I'd like you to think about probiotics the way you think about antibiotics. Yeah, think about when you have a sore throat, you're given a specific antibiotic for that sore throat. If you have a urinary tract infection, you're given one for a UTI. We don't use the same antibiotic for everything. Yeah, so think of probiotics the same way. So if you're using a probiotic, ask yourself, what is the indication? Why am I using this probiotic? What does it help in? What have the studies shown in this particular condition that I'm now using the probiotic? And so when we look around in terms of probiotics and their effect, say in reducing the symptomatology in conditions of autism, there is not strong evidence that they actually work. Yeah, but if you think about something like diarrhea, let's say prolonged diarrhea, there are certain probiotics that help with prolonged diarrhea. If you think about infantile colic, there are some probiotics that help with infantile colic. So you have to think about it individually and then now study which is the one that has been studied in this particular area. Yeah.
Wow, that is quite enlightening. Because as caregivers, we buy almost, we want help, and wherever we hear there is help, we may just run to it.
Just buy, yes, yeah.
So are there tests that are run so that we know my child needs this type of probiotic maybe, or this is the issue that I'm addressing?
Okay, so if we look at the conditions that we're talking about in GI, a lot of these conditions are actually diagnosed clinically. You don't necessarily have to have tests to diagnose some of these conditions. But yes, there are some tests that would perform. For example, if a child comes and is having diarrhea, even if the child has autism, I cannot just assume that this autism is the one that is associated with this diarrhea. I have to investigate this child for more common causes of diarrhea. I have to look and see, is there an infection? Could there be a food allergy? Could there be some medication the child is taking and is causing diarrhea? You have to still go through all those processes before you then say, okay, maybe it's functional diarrhea, which means that I can't really explain it, but it is there. Yeah. So you have to go through the investigative procedures. Something like constipation. The commonest causes of constipation are actually not enough fiber in diet and poor toilet habits. So regardless of the person presenting, I have to investigate those two causes and try to understand what's the diet like. Yeah, so we'll ask you, what's your 24-hour diet recall? I'll ask you to tell me the last day, what did you eat? so that I get a sneak preview of your diet. I get to understand how much water are you taking, how much vegetables and fruits are you taking, how much of dairy are you taking, and so that's where we start. Then with school-going children, we want to find out, are they able to go to the toilet in school? Something as simple as the toilet door doesn't close will prevent that child from using the toilet in school, and they'll hold and they can get constipation. Or maybe the teachers don't give them enough time to go to the toilet. Maybe the toilets are not enough. And those are some things that can easily be addressed, but they can cause problems. Yeah. So we start there before we assume that this is now just because the child has autism. Yeah.
Wow. Okay. You've touched on, how the food the child is eating. And one common thing is that children with autism are picky eaters. You'll find
Yes.
those that cannot stand vegetables, those that cannot stand fruits. So to avoid or help, in alleviating constipation, what can a caregiver do at that point? Because it's picky.
Okay. Yes, actually, it's true that the children are known to have food selectivity, so we call it food selectivity. And I've taken care of a couple of them. And I would like us to first differentiate between a picky eater and food selectivity. So it is common for all children to be picky eaters around 2 years of age or below. Many children are picky eaters as they are trying to learn new tastes and new textures. Many will refuse to take them. But the difference we see is that picky eaters, the pickiness does not last for very long. By the time they are about 4, 5, 6, they start to reduce the pickiness. Or if the food is presented in a different way, they're able to take it. For example, something as simple as a fruit. They may not take the fruit when it is whole, but when you cut it up and put it in maybe a smoothie, they take it, so that they're able to tolerate it. So that we see picky eaters are able to get over the selectivity quickly. But food selectivity as seen in autism many times does not change for long. It stays, yeah? And so they have, it's like a sensory aversion to food. And they reject certain textures, certain temperatures, certain flavors, colors, smells. They refuse them. And you see fruits and vegetables are rich in smell and color. And so they are commonly rejected, yeah? And the child just wants this single type of food that they kind of are used to. They want that bland food. So what would I tell a parent who's going through that? I would say, first of all, you can try to see how can I work within what my child is eating. So first of all, do a food diary. I think it's important for everyone to do a food diary so that you understand. First of all, understand the picture. What is it that we're actually dealing with? And then from there, now you're able to pick up, okay, if the child is not taking fruits and vegetables, and so now we are at risk of having some micronutrient deficiencies, we start on a supplement, even as we try to modify the diet, so that the child doesn't suffer the consequences of the deficiencies. So we start with a multivitamin. Is there a way we can do it? So sometimes you work with parents and you show them how you can blend the food, so blending the food so that if, for example, the child doesn't want to see small cut vegetables, and we blend them, add them to maybe a stew so that it looks like just soup. And that way the child might be able to take it. Or if the child takes white things, can we maybe work with the cabbage and cauliflower, which are not so heavy in color, so that the child then is able to get some of the nutrients, what can work. Or can you work with a form of reward system, maybe give them something that they don't like, then you reward them with something that they like, just different ways of trying to work with it. But I think the first step is to understand what is the problem. Yeah. And so it's good to do a food diary. So that even by the time you're coming to see a doctor, there is something they can work with. And you can see, yes, here we have a challenge with this certain category of food and this certain category of food. Yeah.
Okay. Thank you for that. building up on the foods, there are times we are told, don't give wheat, don't give cow milk. There are many there are many things we are told. Don't give processed foods. So what's your comment on the dietary interventions that caregivers are asked to do to children with autism?
Okay, so first I would say it is not clear for sure that what is called a gluten-free, casein-free diet is the way to go for children with autism. A number of studies have been done, and so in terms of studies and the evidence, we talk about the highest level of evidence being what is called a systematic review. That means that they looked at a couple of randomized control trials, and then were able to now look at them in a number of them and come up with a conclusion. So the highest level of evidence, such as a systematic review, and when a systematic review was done on this particular topic of whether gluten-free, casein-free diet is of benefit to children with autism, there was little evidence that it is actually there. And so it may be working for some, but it's not like it's universal that all children have to be on that kind of a diet. So I'll start with that. And the other thing I would say is when we're looking at feeding children, let's say we're looking at the age between 6 months and 5 years, when we've now introduced complementary feeding, there's what we call minimum dietary diversity. Yeah. So minimum dietary diversity means, is this child getting a balanced diet? When we were in school, balanced diet was carbohydrates, proteins, and vitamins. Now those groups have increased. They're about 8 right now, And so you want to check that the child is getting a bit of everything, at least by the end of the day. There's dairy, there's grains, there's legumes, there's starches, there's fats, those kind of things. And this is information you can actually get off the internet. You can look up minimum dietary diversity and then you see the categories. And so I would encourage parents to look up that and see what can I get, what is within what my child can take that can allow me to cover all the categories. Yeah. And then how else can I manipulate the food? For example, something like saying seeds, chia seeds. The child may not be able to take certain maybe fish or chicken or beef, but chia seeds will give you omega. It will give you omega-3, omega-6. Yeah. So, and you could put the seeds, in a form where they're not even seen and they have really no taste. So there's a way you could mask it, and the child is able to get their nutrients without necessarily having affected the taste. And then, so that is one. The other one is maybe behavior changes that have been done to try and improve kids' diets. So there are a number of methods that have been used. I've talked about the one where you kind of reward the person. There's one where they have like a timing system, and every so often you're supposed to take a bite of some food, which maybe is not, you don't like it, but every so often you take a bite, every so often you take a bite. So it is small, frequent, and at the end of the day, you're able to see some progress. I'm also working with behavior therapists to just try and see how we can improve the child's palate. Yeah. In very severe cases where the child will completely not take anything at all, we've had cases where we've actually had to put feeding tubes, put in a feeding tube so that we're able to give the child the nutrients that they require. And in one case, we even had to put in what is called a gastrotomy tube. That is a tube straight into the stomach from outside, so that we're able to just give the child food, because this particular child would not allow anything except water through the mouth. So there is help available. Yeah. We can also try to enrich the food. Like we can enrich the food with something like a nutritional formula. Like there's one I can think at the top of my mind called Pedisure. So this is a powder But when you add it to food, it increases the nutritional value of that food. So if the child is only taking milk, you can add a few scoops of that powder into the milk, so that now the milk becomes like a full meal, as opposed to just the milk that was there before. And we even sometimes give appetite stimulants and see, and some people respond to the appetite stimulants and it improves the diet. And then things like now putting a bit more fiber into the food so that the child is able to pass the poop, because when they clear out the poop, then the appetite improves, because the whole system is like it's like piping. Yeah. So if the system is blocked, then there's no drive to eat more. But once you unblock it, then they feel like they want to now eat more. So those are some of the things that, some of the strategies that could be used to try and mitigate the GI conditions. Yeah.
Well, thank you. Before we leave that, there's this debate on camel milk, being advisable for children with autism, and not cow milk. What is your comment on that?
Okay, so we use camel milk quite a bit in children who have cow milk protein allergy. Yeah. So the difference between cow milk and camel milk is that the protein in the cow milk is different from the protein in the camel milk. Yeah. They both contain lactose, so the issue is not lactose, but the protein is different. And to some extent, the camel milk protein is said to be easier to digest. And this is, for everybody. It's not specifically for children with autism. So when we get children who have cow milk protein allergy, where they are reacting to the cow milk protein, now you're trying to give them an alternative that does not have the cow milk protein. And that is where camel milk comes in, because it's a different protein. Yeah. And so it works for those who have cow milk protein allergy. But if the issue is not cow milk protein allergy, then the camel milk may not specifically work. If you're thinking about casein versus whey, they both have casein and whey. In fact, I think camel has more casein than the cow milk. Yeah. So the only difference would be the cow milk protein allergy. That is where the camel milk would come in handy. Yeah.
Wow, okay. So it is in order to give, if the child is not allergic or has no issues, you can use cow milk.
Yes, yeah.
Wow. Okay.
And also, not to mention, it's a lot more available. Camel milk is sometimes difficult to find, and it's more expensive. Yeah.
That's true. That's true. Okay, let's talk, let's come back to diagnosis. So we've seen the symptoms. We now can be able to highlight. And where do we start? Looking at a scenario where, one, there is a caregiver in the rural areas. Where does this caregiver start? And then also there is one in the urban. So both scenarios, where does this caregiver go for help? And the whole procedure, what do they expect?
Okay, so I would say in both cases, start with your pediatrician, your general pediatrician. Yeah, it would be good for every child to be followed up by a general pediatrician. And especially if it's a child who's having some challenges, like a child who has autism. You see, autism is touching on many systems, not just the GI system. It's touching on the neuro, maybe it might touch on the psychiatric or psychological, it may touch on genital, it can touch many systems. So you need somebody who knows this child well enough and is following up this child. And so they're able to even detect even subtle changes that others may not have already picked up on. So start there. Yeah, but I would say, even before you go to the doctor, start by doing a food diary. Yeah, if let's say your child presents with something like constipation, ask yourself, what has this child eaten in the last 24 hours? Yeah, what are the foods that help with constipation naturally? Yeah, so I would say naturally occurring things like apples are helpful. They help you go to the toilet. High fiber diet, the fruits and vegetables. So if it's constipation, how can I start to even increase the intake of fruits and veggies even before I see the doctor? If the child is having diarrhea, ask yourself, has there been any contamination of the food or water that the child is taking? Is there anyone else in the family having this problem? Could I do maybe a stool test just to check for common things, amoeba, rotavirus, things that happen to children, just to check that those are not the issues. If the child is developing food selectivity, how can I work within what the child is taking to try and see if this will help? But start with your doctor. So once you've seen the doctor, then the doctor will be in a position to know, is this at the level where we need to investigate, or is this maybe, it's not yet, it's suboptimal. We can still maybe try to work on it, because we don't investigate every child, it would be too much. And even just listening to the doctor's advice, what can they ask you to change, and then you come back and see. So if the problem is still persisting, then at that point you may be referred to a specialist. That would be the neurodevelopmental pediatrician or a gastroenterologist, and then we'll pick it up from there. I'd just say that, remember, a lot of these conditions are clinically diagnosed, so tests are not the things that come to mind first. Many times we're able to diagnose even just by consultations.
Okay, thank you for that. Is there a challenge, out of curiosity, especially for nonverbal children, when we bring them to the doctors? Is there a challenge in picking up what is going on?
Okay, so a joke in pediatrics is that pediatricians are like veterinary medicine doctors. Our patients don't speak. So generally, we are used to patients not speaking, the younger ones. And so we are used to having to poke a bit to understand what is happening. So for sure, at least in pediatrics, we are used to nonverbal children. They're all nonverbal at some point. And still you have to find out what the problem is. But that said, for the older child, it definitely takes longer for that child to come to hospital when they are nonverbal. And so that's what I would like one of the take homes to be. You have to be very aware of your child and what exactly how the child behaves, so that any slight change in behavior, you try to understand what it could be. And sometimes GI conditions can present with just behavior changes or increased irritability, and you can't pick it up. And so at that point, the first thing I would say, just try to touch that patient top to bottom to understand where could the pain be. And if you're finding the pain, when you touch the tummy, the pain is there, then there's something happening there. Something like poop, you can actually feel it when you touch the tummy. You can feel it. And so you can then know that that's the problem.
Well, okay. Just dwelling a bit on behavior, because for many of our children, what we see could be maybe a bit of crying. Is that what we are looking at? What specific behavior tells us or is not well with the tummy?
Okay, so what behavior could that be? So it is anything that is odd for that child. For example, you may notice maybe it seems like after the baby eats, they seem to be uncomfortable. Or if it's just before feeding time, the child is very, very uncomfortable around the time just before they eat. Or maybe it is when the child is trying to pass stool, and the whole passing stool is now a very difficult process. It's a painful process. That should not be the case. And so those are signs. Or if you see like the abdomen is a bit swollen more than usual, the stool is a bit runny, those are signs. Or the child is not finishing their food, why is it? And this is a portion the child was finishing before. Why isn't the child finishing the food? So those are the things that then alert you. It could be that all is not well.
Okay. Thank you for that. You have talked about multidisciplinary approach. So it's important for caregivers to know that it's a whole multidisciplinary approach. Once you go to the, to your doctor, be open that other professionals may be required. And just to put, some small emphasis on that so that the caregiver may know what to expect.
Yeah.
So
Maybe I can make a point on that.
Yes.
Maybe I can add to that. Yeah, you see, like we are saying, autism affects many systems. And so the care needs to involve a number of people. It's a multidisciplinary team. And I'd say that I work at Aga Khan. So here we work very closely with one of our developmental pediatricians. It's called Dr. Susan Wamithi. And it's not just the doctors. We have the occupational therapists. There's I think the behavior therapist is external to Aga Khan. I don't think there are very many. But that is part of the team, even if they are external to the hospital, and maybe a nutritionist as well. And ideally, this should be people who are able to sit around the table when the patient is there, and so that everybody is contributing. And by the time the patient is leaving, so and so has given their input, so and so has given their input. You feel that it was a holistic input. Unfortunately, we've not yet gotten there. And so that is still work in progress, but we do try to still communicate. Once the patient is sent to me, I give her feedback. Once I send her the patient, she gives me feedback. We talk with the OTs a lot, we talk with the nutritionists a lot, so that you're able to give this person a holistic care. Yeah.
Okay, thank you for that. And just to ask, for a child who's had GI issues, since when they were very tiny, do these symptoms, do they change over time? Does it improve over time, or it is as it is?
Yeah, I guess it would depend on what it is that is causing the GI issues. So something like food selectivity, unfortunately, many times it kind of stays on. But things like constipation and diarrhea are things that we can manipulate. Even if it means the patient is on a small dose of some medication, you can have some manipulation. Something as simple as avoiding bananas and pawpaw. These are foods that we commonly take in our diet, but unfortunately, for some children, they cause constipation. And so you might find if you just withdraw those two foods from the diet, you might find the child is okay. Yeah. So I can't say necessarily the symptoms have to always be there, but I know specifically with food selectivity that one can sometimes be difficult to clear.
Okay, can early intervention help?
Yes, definitely it can help, because see, we are talking about the overall well-being of this child. So nutrition is a building block for good health. Yeah, if your nutrition is not good, you will not have good health. And so if we're able to pick up the nutritional issues early, then you supplement and you don't have deficiencies. And that puts you at a better position to deal with other issues. Something like obesity, which I did not talk about. Unfortunately, we have children who are now on the other side of malnutrition. It is overnutrition. And that is because the foods that they crave are not necessarily healthy foods. And so they're at risk of the obesity. So in a patient like that, if you catch it early, you start to manipulate, even if it is that food. Okay, maybe they like to take milk, but instead of a full glass of milk, now you make it half milk, half water, So you find ways of trying to manipulate the diet to just ensure that we are keeping that person's calories down. Yeah. If they like milk, okay, then already because they're getting the lactose, we now remove sucrose from other food, so you don't overload the body with sugars. Yeah. So there are things that you can do the earlier you start, the better. And even for autism itself, the earlier the diagnosis, the better, because then the brain is, it's still forming. Yeah. It's very difficult to manipulate an adolescent brain or an adult brain, but a child's brain, it has what we call plasticity, so it can be manipulated. Yeah.
Okay, thank you for that. Let's dive into future research. I can see the questions are coming in. We will give time to answer all that.
That's
Yes.
okay.
Are there areas of research that are currently being explored to better understand and manage GI conditions in children with autism? And maybe what are some of the examples that you could let us know?
Okay, so currently at Aga Khan, we are carrying out a study to understand the challenges of caregivers during meal times of children with autism. So one of the challenges we've had is, caregiver fatigue and just frustration, and so wanted to understand a bit more about that, so that we're in a position to come up with suggestions of how to change that. And so that's a study that we're doing myself, Dr. Wamithi, and one of our other residents in the department. But there are also a lot of studies looking at benefits of medications in altering the gut microbiome. There is studies on the probiotics. There's studies on behavior therapy, which is the best way of doing behavior therapy that works. And right now, there's a lot of interest in autism, the world over. Yeah. We are asking ourselves, why are the rates going up? Is it something in our environment? If it is in our environment, what is it? Is it the food? Is it the medicine? Is it the genes? What is it? So there's definitely a lot of research going on right now in autism. Yeah.
So as caregivers, we just keep our ears open because we know anything that could help will be welcome.
Yes, but I think as caregivers, you need to be very careful so that you know what you're taking in and what you're not taking in. So for me, I want you to be shrewd and to question whoever is coming with the evidence of something that is working. Now we have talked about systematic reviews. So ask them, what is the level of your evidence, so that, because unfortunately people take advantage. Yeah. And so it becomes a business. But I want this group to be very shrewd in what they allow to be passed as something that is beneficial. Yeah.
Wow. Thank you. Thank you for that. It's actually gone into our next question on family and caregiver support. And you've already begun by giving us one advice. and several others you've mentioned, like on the dietary intervention, what to do. Maybe as caregivers, what tip can you give us on advocating for our children in a clinical setting? Because you will find that we may take our children in some hospitals and there's a communication breakdown between us and the doctors. Because what we can see, probably from our nonverbal children, is not exactly what is playing out when we are in the clinical room. And sometimes you might go either with a misdiagnosis or you felt that your child was not understood. So how can a caregiver advocate for their child in a clinical setting?
Okay, so one of the things we talked about is the food diary. Yeah. And so if you're coming with your child and you're telling me this child is not eating this, and this, and you're showing me a diary, you're showing me, I've been recording what this child is eating from Monday to Monday. This is it. You see, that is very strong evidence. Even if maybe just outside the clinic, the child accepted to eat something, but the last week has not been eating. Yeah. So that helps you. It strengthens the desire, your what you're saying. But I think on our part as doctors, and let me speak for nutritionists, we need to do a lot more awareness, and so that doctors are able to pick and to harness the information that is coming from the caregivers, because this is the primary caregiver. This is the person who's with this child the most, so you must listen to that person, and give them the time. And we say in pediatrics, even just a mom coming and saying, my child is not themselves, that is in itself a symptom. The parent does not even have to be able to describe exactly what does not being themselves mean. just saying my child is not themselves, it means there's something they've picked out. I'm duty bound to investigate and to understand what is happening, what could be happening in this child. Unfortunately, our healthcare systems are quite crowded, and patients with autism require time, And so when you're being timed and you're told every patient, there's a long queue, now frustrations start, and someone is not able to give this patient time. Yeah, but it's unfortunate, because definitely the time should be a bit more. Even in terms of like things like triage, waiting time, you should be able to offer a parent an option that, come and register, go and wait in the car or in the parking lot. When it's about your time, we shall call the patient, because sometimes sitting in those waiting rooms causes a lot of anxiety for the patient and therefore for the caregiver. So we need to learn how to be a bit more accommodating. Yeah. But bear with us. We are also learning. And we are going to spread out the word. I think such meetings like this are very good. And I would like to encourage you. We have what we call a Kenya Pediatric Association. Yeah. So this is the umbrella body that is in charge of the pediatricians in the country. And we have a number of pediatricians now who are developmental pediatricians who are championing the idea of the care for the child who has autism. And we would want to partner with you, we'd want to have you come and speak to us, have us speak to you, so that we are able to help each other. This should not be a one-off meeting. Yeah. So the more we talk together, the more we understand each other, and we're able to help the children together. Mm-hmm.
Thank you. We appreciate that. We've actually initiated talks with Kenya Pediatric Association, so we are happy to hear that.
Yes, I am a member there, so I'm happy to hear that.
Santi, maybe just an idea. You've mentioned something that we go through so much when we come to hospital. As many caregivers, we have not all of us may be having, the cars, but maybe a play area could be good, a sensory room. It could really help when we are waiting to be attended. But,
I hear you. I think, and even speaking from where I work, we don't have a sensory room. And I think it's just, it's an issue of really awareness. So what we would do probably in our hospital is, if we notice a child who has a developmental challenge, then you fast track them so that they're not waiting for too long. But I hear you, it would be good to have a space where, the child can maybe just, their energies can be spent as they're waiting. Yeah.
Yes. Asante sana. I want to just bring in the caregivers right now so that we can pick the questions. As we move along, then we'll give you an opportunity to give us, a parting shot towards the end. So right now, I want to pick the questions. You can lift your hands. As you lift your hands, I can read through the questions that are coming. So starting with the first comment that I can see here. Thank you. The name is Thriving Tools. Hospital visits are very stressful for autistic children and parents. If the various specialists can be synchronized during consultation, that can be very helpful. Oh, okay, it's a comment. Caregiver fatigue would considerably go down and the outcomes for the kids would be better. Thank you for that. Does observing diet improve speech development? What causes toilets delays? And how better can one equip a child for toileting?
Okay. Yeah. So you said the first question was, can better?
Does observing diet improve speech development?
Speech development. Yes.
Okay.
Yes, we said nutrition is the building block of good health. So if you think about something like your micronutrients, your micronutrients will help you with your brain development, which is really where the speech development is coming from. Omega-3, omega-6, vitamins, the B complexes, the vitamin A, vitamin D, all those will help. And so it's important that the child is getting a balanced diet. Yeah. Then there's a question about, just read for me.
What causes toileting delays and how better
Okay.
can one equip a child for toileting?
Yeah. So toileting should be directed by the child. Don't force a child to be toilet trained when they're not ready to be toilet trained. It causes a lot of confusion to them and a lot of stress. And they interpret going to the toilet very interestingly. It's like if I go to the toilet, that is a reward, to you. And so they hold so they don't reward you because you're stressing them. Yeah. And so when you start to notice that your child is not comfortable passing stool in an open space, that is a cue that they're now ready to be toilet trained. So they're looking for a corner to do their business, something like that. They are now starting to be aware that this is not something you do in an open space. So you get a potty, put it at the corner where they like to go. And even if they pass stool on the diaper, you transfer the poop into the potty and you show them the poop goes into the potty. The poop goes into the potty and they start to learn. With time, if they are regular in terms of going to the toilet at the same time, if you feel it's around that time, you can put them on the potty. And then when they pass the poop, you reward. But if they don't pass, you don't punish. Yeah. And so with time, they learn. Yeah. But let it be driven by the child. Yeah. The other thing that happens sometimes when they go to school is peer pressure. So they notice others are doing it, and with time, they also learn. Yeah.
Okay, thank you. There was also attached to that, yeah, I think you've addressed it. How better can one equip a child? Then there is a question here. Does using electric brush guarantee speech?
No, I've not heard of that. Yeah, I don't think it doesn't guarantee speech. It may trigger the mouth. It may bring some more sensation because it stimulates more than a normal brush, but it does not necessarily trigger speech. I think that question may be in terms of what is the effect of the electric toothbrush would be best handled by a speech therapist. Yeah. But to the best of my knowledge, I don't think so.
Okay. Thank you for that. The follow-up question to that is, what age does one know that the child will not speak at all?
Okay, so we have children who are neurotypical, who are not speaking by 3 years. And when they go to school, they start to speak. And so I would wait. I would definitely wait, maybe to around 4 or 5 years before you know for sure that now the child is unlikely to speak. And even that said, once you start to do some therapy, the child can.
Okay, so just early intervention on therapy and observing. So I have another one here. I heard that sheep milk is good for children with autism. Why so?
Sheep milk? No,
Yes, sheep.
I've not heard of use of sheep milk. I've heard of goat milk and camel milk and even buffalo milk, but not sheep milk. So I cannot comment on that one.
Okay. Elizabeth, sorry, I forgot your last part. Are all children supposed to learn sign language just in case they can't speak?
No. No, I think it's a bit premature. Yeah, I think you wait. I think sometimes the anxiety is more for us than for the patient. Yeah. So we just keep it, wait. Yeah. And this is across even for children who are neurotypical. Some take longer to speak than others. It's a range, just like weight is a range, eruption of teeth is a range, so speech is a range.
Okay. There's a comment here. Very interesting to learn that there's suboptimal evidence around the gluten casein-free diet and the feedback from systemic reviews of the same. Then there's a question, why is cow milk not advisable to children? Okay, I think you tackled that on cow milk, about the protein. Let me read it through. Why is cow milk not advisable to children with autism? My child is 3 years and 4 months. Which ways will I follow to reduce hyperactivity and trying to gain concentration?
Okay, so first of all, removing cow milk does not necessarily, can you hear me?
Yes, we can.
Okay, yeah. Removing cow milk does not necessarily guarantee that this child will have less hyperactivity. And yet, it can even cause malnutrition. So, I see parallels, especially with children who have food allergies, where parents remove so many foods from the child's diet that the child now ends up being malnourished, and yet they may not even be allergic to some of these foods. So remember, whenever you remove a food from a child's diet, you must replace it with an alternative. Yeah, you can't just leave that gap there. And milk is a very major part of a child's diet up until 2 years, not just the part for exclusive breastfeeding. Up until 2 years, that child should be taking a minimum of 500 ml of dairy per day. Yeah. So when we remove it, you must be sure that this child has an allergy to it, and that the only way around is to remove it. Yeah, so I wouldn't encourage somebody to remove milk because they want to check that the child is less hyperactive. Yeah, the studies don't really support that. Yeah.
Okay, and maybe just to follow up on that, there are some of our children who don't like milk, the texture, the taste.
Yes.
Can yogurt be a substitute?
Yes, yogurt is a good substitute to milk. The only difference between yogurt and milk is that yogurt is fermented and therefore it is lactose free, while fresh milk has lactose. And so even for some people, they tolerate yogurt better than they tolerate milk. And in terms of the cow milk protein, in terms of the nutritional value, you are giving the child good enough. So I don't have a problem with that. But I would add a caution here about what we call plant-based milk alternatives. Yeah. So there are people who then now give plant-based milks like almond milk and rice milk and oat milk, yeah, and soya milk. So generally, plant-based milk alternatives are lower in their caloric intake, especially protein. They are very low. The one that comes close to milk is the soya milk. So that one is a fairly good alternative, but the others, they are not good alternatives for growing children. They do not give them enough nutrition. So don't give it thinking that now I have replaced milk. It won't work.
Wow, thank you. Thank you for that. Actually, we've encountered very many caregivers who do that. Thank you for that. We have a question here. How can we conclude the relationship between GI and processed foods versus non-processed foods?
Okay, so I think, we are now going full circle and accepting that the more natural, the better. And so the more processed the food, the more we really don't know what is in it. Yeah. And so processing food is it's kind of it has come as a mention of necessity because we are not where the food is growing, and so it has to be preserved, it has to be processed for us to get it. But as much as possible, keep food natural. When you don't have a choice, then yes, you can use the processed food, but as much as possible, use the natural food. And this is not just for children with autism, it is for everybody, where we really don't understand the full effects of some of the preservatives that we have in our food.
Okay, thank you for that. Another question here. My son is 8 and refuses all types of fruits. I was told it's the texture. He's not picky at all and eats vegetables very well, but still gets constipated.
Okay, so I guess I'm happy that the child is taking vegetables because at least they're getting their vitamins and minerals from that. Now, in terms of the fruits, I would suggest, yes, the fruits can be the texture can be different, but you can try to change the texture of the fruit. For example, maybe trying to put it in a smoothie, or even removing the skin so that it's really fleshy, or, just trying to manipulate it. I know people who blended the fruit and put it in form like of an ice cream. You put it like a icicle, ice lolly, for a child to suck on. But whatever they're sucking is fruit juice. Yeah. So that we just have to try and see how we can be creative. But at least because the child is taking vegetables, it's not too bad. The child will get the minerals and the vitamins that are required from the vegetables. Yeah. So what would help in terms of now constipation? See if you can have more fiber in the diet, like your rice, your unga for ugali. Can it be having fiber, more fiber, so that the child is then able to go to the toilet.
Okay, thank you for that. There are two questions here. What is the reason for the high prevalence among those with autism from the research? Sorry, I might have missed that. Some caregivers may not sense these symptoms in good time due to lack of access to information. What's your take on this?
Yeah. So in terms of what could explain why there are prevalence and incidences of GI conditions, it's what we're talking about, that the gut is primarily like an immune organ. Yeah. And so conditions where we don't fully understand autism, we don't fully understand what causes it, but some of the thoughts are around some dysregulation of the immune system, some dysbiosis of the gut, some neurodevelopmental issue, and the gut is what we call the gut-brain axis. So those conditions then suggest that those who are having some issues with maybe the neurodevelopmental would have more symptoms with the gut. Yeah. And then there's the perception of pain. There are people who have a high threshold for pain. There are those who have a low threshold for pain. There are those who have a hypersensitivity. So the sensation is the same, but one perceives it as being pain, and another one doesn't perceive it as being pain because of the development of the brain. So that is the same thing that's happening in the gut. The same way, say, like in the mouth, there's this person who you just try to put some food in the mouth. For them, it's a very unpleasant sensation. The same thing could be happening at the level of the gut. That any slight distension of the abdomen because of gas, it's perceived as being a very unfavorable kind of sensation. Yeah. So those conditions therefore put children who have autism at a higher risk of GI manifestations.
Okay, thank you for that. We have another question here. My 12-year autistic is always complaining of nausea and often induces vomit. Is it part of GI or is something else happening? We've been treated for constipation before, and recently all stool tests have been okay.
Okay. So if you're having nausea and vomiting, whenever you vomit, it's an involuntary action, and you're getting the contents of the stomach coming back into the esophagus. And when food gets into the stomach, it mixes with acid. So when you reflux, that food has acid and it comes up the esophagus and it starts to burn the esophagus. So you get into a vicious cycle, because now you get esophagitis, which triggers nausea, which triggers vomiting, worsens the esophagitis. And so you get into a vicious cycle. You also need to look up if it has been going on for longer than 2 weeks. You need to check if the child could be having H. pylori, which can also worsen the symptoms. So I would say maybe you could try an antacid and see if that helps the symptoms. If it's not helping the symptoms, then check for H. pylori and see if you need to treat that.
Okay. Another one, my autistic son likes eating mattresses and sponge. How can I help him stop?
Yeah, so that could be what we call PICA, P-I-C-A, where the child is looking for certain micronutrient deficiencies like iron or folate or calcium. Yeah, so I think it would be good to first check their blood levels for iron, for vitamin D, for calcium, magnesium, and if there is a deficiency, you give it in the form maybe of multivitamin. And so the best way to give a deficiency is to give it in a high dose, like specifically. So if you find out the problem is iron, don't give just a plain multivitamin. Give the iron supplement itself so that you're able to give in good quantities that correct the deficiency. If you find it's vitamin D, the same. But I would encourage you to look for any micronutrient deficiencies in that child.
Okay, thank you, Daktari. Does deworming help in addressing GI conditions, and how frequently should a caregiver do?
So for children less than 5 years, we advocate for deworming every 6 months. And that is across the board. So what does deworming do? Children are at risk of eating dirty things, yeah? And so they can get worms. And so you're just confirming, clearing, so that they're not affected by worm infestation. Because the worms then feed on their food, they take their nutrients, and they affect the child's growth. Yeah. So every 6 months, you should deworm a child between 6 months, 1 year and 5 years.
Okay, thank you for that. We just buy across the counter.
Yeah, just the normal one. Yeah, that dawa is okay. It's safe for everybody. The only person who should take it is someone who's pregnant, because it can cause problems. But other than that, it's safe.
Okay. I would like to get more information about fecal transplantation.
Okay, so you see, the idea is to modify the microbiome by bringing in good protective bacteria. So one way of doing that are the probiotics, which are good protective bacteria. But the challenge we said with that one is that the effect is not sustained. And so one of the other ways of doing that is bringing in bacteria from another person's gut. And so that process is what we call fecal microbial transplantation. Yeah. And fecal material is actually obtained from a healthy person. It is cleaned and it is packaged in form of capsules. And it is then given in terms of medication. Of course, and it is at that point, it is strict. It has no infection. It is sterile. And the person is then still observed in a hospital setting. So this is not something that we are doing locally, but it is definitely done out there. The other condition where it has been used is in what is called inflammatory bowel disease, and also for an infection called Clostridium difficile. So those two conditions, fecal microbial transplantation has been used. But if you want to discuss it further, you can see me. You may attend.
Okay, thank you. Thank you for that. Let's talk about the role of exercise. Does exercise help in any way to alleviate GI conditions?
Yeah. So exercise does help. And you see, if you have somebody who's lying in a bed, even the gut is slow. They are not able to pass stool as frequently. Even their respiratory system is affected. So moving around, it is good for the whole body. You get to move. But beyond that, when you exercise, your body releases feel-good hormones. And those feel-good hormones just calm everything down. They bring down your heart rate, they bring down your blood pressure, and they even help you with absorption of nutrients and avoidance of constipation. So definitely exercise is important. I would say a good diet and exercise are mandatory. Mm-hmm.
Okay, thank you for that. So we observe exercise. Just to mention, maybe exercise like running, maybe, or
I think it depends on what you're comfortable to do. Yeah, but so for you to be active, we say you want to be active at least 1.5 hours, 3 times a week. Yeah, and that is good. So even for our children, engage them with sports, even outside what the school is offering. Because if you think of just a typical PE lesson of 40 minutes, 10 minutes is dressing up, 10 minutes is coming back to class. I mean, they are literally walking around for those 20 minutes. And even the time when they're supposed to be exercising, we are waiting for so-and-so's turn, we're waiting for so-and-so's turn. So they're not active for most of that time. So we as parents have to take it up and make sure that they are active even outside of that PE lesson. Mm.
Okay, thank you.
Hi. Hello.
Yes.
Hi. I'd just like to ask, based on what had been spoken about probiotics, and my specific issue is really the concern around the sustainability, particularly with those that are medication-based. Yeah, and also just to find out alternatives beyond this that we've just been told right now around the fecal transplant, if I'm not wrong, and also the probiotics that we get given in hospital for our children. This what are they called? This liquid-based. Yeah. I know I know we've been told that it's very specific to the kind of issue that they're having in terms of probiotics. But what is just one food that probably can cut across for all kids that can be sustainable, not necessarily sustainable, but a parent can provide for the autistic child at home beyond the medicine, and also now going for this, if they have issues, this fecal transplant. But what is 1, 2, 3 foods that can guarantee that at least you know that your child's diet is, has probiotics throughout, because now we are looking at the issue around, of course, sustainability and just not having the kids on medication throughout, particularly our autistic children. Thank you.
Okay, Santi.
Okay, thank you very much. Unfortunately, I don't think that such a food exists. And we don't have, you have to keep, so you have to keep giving the balanced diet, and even the balanced diet itself does not give probiotics. Yeah. So what can you do for your child? Let's say you're trying to think about how can I improve this child's gut microbiome naturally. Yeah. So the best thing would be to give natural foods, because natural foods encourage growth of the good bugs, while processed foods, high starch foods encourage growth of the bad bugs. So give your child as much as possible natural foods, because that kind of encourages good protective bacteria to thrive naturally without having to give probiotics. But there's no food I can say this food gives you probiotics. Oh, no, it doesn't exist. Mm.
Thank you. I hope that has answered. We give a lot of natural foods.
Mm.
Okay, there's a question on inulin, and there are specific benefits for using it.
Maybe you can just read out the question again, please.
I would like to learn more about inulin. Is there any specific benefit?
Okay, I think inulin is what you call a probiotic, not a prebiotic, but a probiotic. So probiotics are foods that feed the prebiotics, the food for the prebiotics, the good bugs. And so inulin is one of those foods. It's an undigestible food, so it goes through the gut, it goes into the large bowels, and then it feeds the bacteria so the good bacteria can grow. So that is the role of the probiotic. Yeah. And so you see, this area is growing. So now there are those who combine a probiotic and a prebiotic, and they call it a symbiotic. Yeah. And so all these foods, all these medications are supposed to improve the gut microbiome. So what I can say is inulin is a probiotic. It is good for giving food to the good bugs to help the good bugs to grow. But in of itself, it doesn't necessarily change the microbiome.
Okay. Do you have the symbiotics in Kenya?
Yes, they are there. They are there. They are there.
Any brand that one can look out for?
No. I'm really trying to discourage looking for a particular brand as a panacea that covers everything. Yeah?
Okay.
But I can tell you, like, there are other types of probiotics. There's what you call galactose, oligosaccharides, fructooligosaccharides, GOS and FOS. And so those are also probiotics that are found, that are put together with the prebiotics. Another way of looking at it is, if you take in more fiber, that fiber that is undigestible will provide food for the prebiotics. Yeah.
Okay. We are about to close in on the questions. I think I'll take the last three here. Is a child mouthing things a sign of iron deficiency?
Mouthing, what do you mean by mouthing things?
Maybe the caregiver can explain to us. Mary, kindly unmute. Mary? Okay, maybe as we wait for Mary, we could be answering this one. Are suprabrain and omega-3 safe for consumption by a kid who has speech delay or autistic?
Yeah, omega-3 is safe for consumption for a child with a delay. I'm not sure I know what suprabrain is, but if it is a supplement that has omega-3, if what you're looking for is omega-3, give the omega-3 itself. And there's omega-3, 6, and 9, and you can give it as it is. Yeah.
Okay. Mary, are you with us to just shed light?
Yes, I'm here. By mouthing things, I meant putting random things in her mouth, toys, if you're outside, stones, just basically putting random things that she's not supposed to eat in their mouth.
Oh, okay. Thank you for clarifying that, Mary. So it's not always a sign of some deficiency, because children go through what is called an oral phase of growth. There's an oral phase, there's an anal phase, there's an inquisitive phase. There are different phases. I think that was by one of those famous psychologists. I think it was Freud or one of those. And so there's an oral phase. An oral phase, they are putting everything in their mouth. It's not necessarily a sign of a deficiency. It's like the mouth is the organ they're using to sense the world and to understand the world. So everything goes into the mouth. Yeah.
Okay.
Okay, so this is even for an older child. So this is a 4-year-old. Is it still the same?
A 4-year-old. A 4-year-old. Even for it could be. I would say, don't assume it's a deficiency,
Okay.
but don't ignore it. Maybe you can just take a full blood count to check at least that the iron level is normal. Then if it is normal, you just let it be.
Okay, understood. Thank you.
Thank you for that. Now we are coming to an end. Dr. In brief, is there any connection between GI and low zinc and magnesium levels?
Yes, the gut lining thrives on zinc. And so you notice when a child is having diarrhea, and so we are afraid that the gut lining is being affected, one of the medications we give is zinc as a supplement. And so if you have low zinc levels, your gut will be in trouble. And so it's important that the zinc amounts are adequate. Yeah. Magnesium, not as much. Magnesium is more involved with the neuronal development than the gut. And so when magnesium is either low or high, what the person presents with is more of neurological kind of symptoms.
Okay. Thank you so much for all the input, Dr. and for all of us who have really taken their time to join us, all our participants. We are very grateful. In a minute or so, we'd like to request Dr. to give us a parting shot, and then we'll close with a word of prayer and call it a day for this webinar until next month.
Okay. You'd like me to do a parting shot?
Yes.
Okay. Well, first of all, when I was first approached, I think it was by Lillian. I had never heard of gifted gems. I had to go and Google and understand who I'm talking to and who are these people behind gifted gems. But I was so encouraged to find a community that is working together and learning about how to take care of their children together. And I think this is probably the greatest resource that parents have, a place where they can come. Then I looked at different topics you've been studying. I saw a talk by Dr. Madu, who I know, and others. And I'm very encouraged by that out what you're doing. So I think this is absolutely great. It is fantastic, and I welcome that kind of interaction as medics. Yes, we stay in hospitals, but I think our biggest impact will come when we go back to the community and meet with the community, like this kind of a meeting. And so we're able to interact with more people, maybe even prevent conditions, as opposed to waiting for that one child who will get sick and come and see you in clinic. And so this is a great initiative, and I'm very excited to have been here, and I wish you all the best. In terms of GI conditions and autism, I think what I would say in brief is, yes, it is true. Children with autism have more GI conditions. Some of them affected by the unique characteristics of children with autism, but others not necessarily because of that, but because generally children do have GI conditions, and so they are common to all children. There's help available. There's something that can be done, and so come, let's talk. Let's see how we can try to make that limited diet work. Let's check and see if there are any micronutrient deficiencies so that we can treat them. You have to be very aware of your child, very aware of what is normal for them, what is not normal for them, and also take time to look at the diet. The diet is very, very important. We are what we eat, and that applies to children as well. And so take time to look into their diet, ensuring that there's good diversity in their diet, and whatever is removed, maybe because it's making them sick, there's a good alternative that is put in place. And as medics, we are here to support you as much as we can, not just as individuals, but even as an association. So I welcome this collaboration between us and Kenya Pediatric Association and Gifted Gems, and even other groups that might be out there taking care of children with different special needs. So thank you once again, and I've enjoyed myself very much. Thank you.
Thank you very much. We truly appreciate Dr. As I said when we were beginning, we are really humbled and honored to have you amongst us. We don't take it for granted.
Mm.
And I think even beyond this, we will also follow up and see how we can continue with this engagement further. And to all of us, God bless you for creating the time. Thank you for the feedback we are getting, that you have enjoyed the session and you have learned quite a bit. And I know as we plan for our next webinar, we'll reach out and let you know when it will be. And once we get a doctor to come and also talk to us, we will let you know. So we want to close with a word of prayer. And I would like to just ask us to, let's just pray. Let's pray. Lord, we thank you for this beautiful afternoon. And we just want to thank you for seeing us through this webinar and for what we have learned. We pray that you'd bless Dr. Washeke, you'd bless every caregiver who has created the time to be here and those who will also watch after this. And we're just grateful and be glorified in everything. In Jesus' name we pray.
Amen.
Okay, thank you so much.
Thank you very much. Asante sana.
Thank you, Daktari. Have a blessed week, remaining part of the week and the day.
And you too. Thank you.
Asante.